The next topic that we're going to address is sickle cell anemia. It is inherited. It's a disorder of your red blood cells. There is a blood test for it. It's very easy to diagnose. Normal red blood cells are really quite small and they're round. Many times as they're moving through blood capillaries, they will slip through single file, so it can get pretty crowded. Sickle cell red blood cells look like a banana, and so it's very easy for them to slow down or even block blood flow, and that, of course, is going to block the oxygen to different parts of the body. So what are some of the symptoms? Well, first of all, anemia. Normal red blood cells can live about 120 days, which is about 4 months. Sickle cells only live 10 to 20 days. And you're just not getting enough oxygen to your cells and you feel fatigued. Sickle cell causes a lot of pain when the blood flow gets blocked in tiny blood vessels. In the chest and abdomen, joints and bones, you can get extremely acute of short duration pain, or you can experience chronic pain. And sometimes it's severe enough that you have to be hospitalized. You can get swelling in the hands and feet, and most of the time, again, that's because of blocked blood flow. You get frequent infections, particularly because sickle cell can damage the spleen, and that makes you more vulnerable to infection. People with sickle cell have delayed growth or puberty because they have a shortage of healthy blood cells, and that means that their tissues lack oxygen and nutrients. It can give you vision problems because it causes damage to the retina and many other complications. Sickle cell is inherited as an incomplete dominance, where from your parents, you might inherit a big S, which means that you have normal red blood cells. You might inherit a big S, little s, which means you have sickle cell trait. You can still, when you have sickle cell trait, experience some of the negative influences of sickle cell. And that's why we are so insistent that people joining the armed forces and those that are going to be participating in athletics get a physical, because we have had people who actually put on a backpack, their boots, hike 20 miles and fell dead. Because when you have sickle cell trait, if your body gets under stress and gets dehydrated, then you can get into trouble very quickly. Little s means that you have full-blown sickle cell, okay? So let's look what happens, for example, if you have two parents who marry who have sickle cell trait. And we have to remember they may or may not know that. I guess I should make the little ones cursive, okay? So put it in our Punnett square, and you'll notice we're going to have children that are normal. So it's 25% normal. And then we're going to have children, 50%, that are carriers. They have the trait. Okay. And then we're going to have 25% of our children with sickle cell. So that's going to be a 1 to 2 to 1 ratio. And you know, with a simple blood test prior to having children, you and your partner could determine your chances of having an issue.